Research physicians at Johns Hopkins University have determined that there is a direct correlation between untreated hearing loss and dementia. A very large component of hearing health care is brain health. We know that it is healthy for the brain for a person to have hearing devices that will amplify sounds, keeping the nerve pathway from the ear to the brain stimulated and enabling the language processing area of our brains to function the way they should. As audiologists at Southwest Hearing Center, we have learned through newer research that we actually hear with our brains based on the information that the ears can send to the brain. The brain is a unique organ that is able to organize and sort sounds effectively. But if the brain is not obtaining the information it needs, then it has to work much harder to fill in the gaps, to determine what it is that a person is saying, particularly in the noisier environments. And I will tell you as an audiologist that a person can be sitting right in their living room, visiting with friends or family, and be isolated. They'll miss punchlines to jokes. Another form of isolation would be being afraid to participate for fear that they may be asking a question that's already been asked, or that they may bring up a topic that people have already spoken about, so that a person will start to withdraw and isolate themselves. That results often in depression. People stop participating in activities that they once enjoyed just for the fact that they're concerned that they may not be able to hear and enjoy the conversations with others around them. Another form of isolation is isolation from environmental sounds. Each of us have sounds in our daily environments. It could be something as simple as the refrigerator humming, our television running, the neighbor mowing their yard next door, birds chirping outside, hearing the garbage truck down the street. All of those are important sounds that put us in touch with our environment and give us a sense of security in our living situations. In the research that has been done on the correlation between dementia and hearing loss, they have found that those who have hearing loss, who actually wear their hearing devices, do not show any greater likelihood of developing dementia than the population in general. So here at Southwest Hearing Center, we will not only perform appropriate hearing evaluations to determine the patient's hearing loss, but we will help them select hearing devices that will enable them to be in touch with their friends, with their loved ones, and to be able to participate actively in life. That is what is healthy for us emotionally, and that is what is healthy for our brains.